I want to answer the question on why my nail technician now makes me look bad. This is kind of a tongue-in-cheek type of intro here, but I've been using a nail tech for about 6 months in my office. The way we use her, she has her own nail salon, and she's not as busy in the morning hours. I guess I didn't know this, but the natural progression of salons is a lot of afternoon appointments and weekend appointments, and so she has her mornings free, and she was excited to work for us. Now, I want to be clear. She was not the first one that we went through. So a lot of times we try to perfectionize over getting the perfect person, where I think in the beginning you just need to get someone because you are bad at training them, you are bad at hiring them, and they don't know what they're doing either. And so we went through a couple of ones that didn't stick, but finally the third one stuck. And I think this is the same thing as well for a scribe. You can't look for the perfect scribe. You have to just have a good process. And I think you could even say this for employees, right? Because employees leave, so it's not really getting a perfect employee. It's having a good training system for that employee. So Marjorie is her name that works with us, and she works with me Friday mornings, half day, and she does kind of all the nail care. So I have appointments usually every 20 minutes, but on routine days I do them every 10 minutes, and then she has her appointments every 20 minutes. So, and she's doing all the nails, and it took me about 6 months to train her. She's doing the nails, because that's within her scope. I've also trained her to do some calluses, so I trust her, I've trained her, and I am going in and seeing each of these patients and doing the notes. And then so I go in, kind of say hi to the patient, and I do, or Morali, my scribe, does the notes, and then basically that's it. And then I also evaluate if they need a diabetic foot exam, or I evaluate if they need ABIs or something else like that. So that's how we use Marjorie. Now, why does she make me look bad? Well, she makes me look bad because she doesn't make the patients bleed as much. That's kind of my joke. She is a little bit, I don't know if it's more careful, or maybe I try to get out more of the edges, and a lot of times patients come out with 2 or 3 Band-Aids with me, but with her, not as much. So less Band-Aids, hurts a little bit less, the patients tell me, and they like her. She's very good at talking, like a lot of these nail techs and hair techs and things like that are good at doing. So that would be my word to you. Now, it took us, I've been in practice for about 15 years now, and it took us about 15 years to do a nail tech. And if I could do it over again, if you have too much pent-up routine care that's kind of glutting your schedule, because those tend to be low-value patients, it would behoove you to use a nail tech. Now, there are a lot of conversations regarding a nail tech. There are, is it within their scope? Should they be treating patients? Can they be treating Medicare patients? I don't want to get into all of that. I just find that in my practice, I would be fine doing all of them. I was doing them all. We have a high comfort level, and she works under me. So basically, I'm responsible. I'm going to see all the patients. I'm always in the office, and I only do a half day, so Friday half day. So just a thought. That's kind of how we do it. But we went back and forth with my partners of like, should we be doing this? Is this legal? Is this something that the patients would mind? Now, let's talk about patients' perception. So so all the follow-up patients go on her schedule. They just say, you're going to see the nail tech. I haven't had any patients that didn't want her. I have a couple of patients when they come in, they say, I'd prefer to see the doctor, just because maybe they like me, they like to know about my kids, things like that. And so I will see those ones if they specifically request. And the way we do it in our office is we put a little sticky note on the door. I don't know how you guys do it, but the way we do it for seeing patients is so we know who's next. The staff puts a little sticky note, a little post-it note with the patient's kind of first name, and then they put in kind of what they're there for. And this makes it a lot easier for us. And then we also have a flagging system to know who's like the first patient, who's the second patient, who's the third patient, when we have multiple rooms kind of backed up in our office. The post-it note is also beneficial for 2 other purposes. I don't know if you use a post-it note. There's probably a better way, but I haven't figured it out. Okay, I know some people use like the home screen for their computer. Like they would put up a big, almost like a television that shows what room to go into and what they're there for. That might be less paper, frankly. But there's another added benefit to these post-it notes is when I do nail samples, I just write what toe or a toenail I took, and I just put that little sticky note on there. Same thing when I do biopsies, I put the little sticky note on there. So it makes it a little bit easier for tracking of pathology types of things in the office. And also, I know this is going to sound funny, but it helps me remember the patient's name, because a lot of times there's so many patients, I don't remember all the names, especially with a newer patient. And so having it written down there, I can refer back and try to use their first name. Okay, so this is a recording of a Friday, and so the first half of the day, once again, was with Marjorie and seeing routine nail care. I'm going to go through what we saw in the afternoon. So the first patient in the afternoon was a 61-year-old female. She had right heel pain, and she got the Pelto special. Once again, Pelto special is the night splint, foam rolling, and morning stretch. She got x-rays, she got ultrasound, and she was wearing fit flops. I don't know if you know fit flops, so I usually recommend UFOs, but I think the fit flops are probably okay. She's going to be working on the soft tissue, and if it doesn't get better, she's going to follow up. Her ultrasound was not all that thick, so I think a lot of hers has to do with the tightness. And so I think with taking care of the tightness, she'll feel better. I did have two Cariflex patients. One was a 71-year-old female. We did bilateral Cariflex, and she purchased the kit. The other one was a 38-year-old female for left Cariflex. Now, I'm trying to have these Cariflex patients be seen in Marjorie's schedule for two reasons. One, because it just takes me forever to make it look good, and I tend to get really behind as I'm doing them, and it's really not the largest check. Maybe it's okay if they're doing two nails, so two nails, I charge $125 for the first nail, and then $50 for the second nail, and then we charge $75 for the kit. So for two nails, it's a little bit better. If they're just coming in for one nail, or let's say the darn thing falls off and I'm not charging them at all, or just doing an office visit, it's not really the most beneficial. So I'd like to have Marjorie do more of those. Once again, that's within her scope of practice. Next patient was a 65-year-old female for right Achilles tendon pain. She is a nurse practitioner, dermatology. She has some bulbous change. She has a very small bulbous change in the back of the Achilles. It's not too severe. It hurts a little bit. We talked about her equinus that she has bilaterally, did the Pelto special, once again, night splint, foam rolling, morning stretch. And I'm not going to see her back. If the pain gets worse, she'll come back in. But her pain level isn't all the time, and it's not very high. And so she would certainly benefit from shockwave, and I talked to her about shockwave. But if the pain isn't all that bad, she's not too motivated to do that. Next patient was a 66-year-old man. He's doing Qutenza number 2. The only struggle I'm still having with Qutenza is the documentation in our medical record, because there's two options with Qutenza. One is like the buy and bill, and the other one, meaning that means we buy the product and we bill the product. And the other one is where it goes to a specialty pharmacy and we just get the product in. So those are kind of the two ways, depending on their insurance. They kind of help us with that. And then when they come in, then we apply it. The application is really easy. And we started out by doing everything ourselves. Now, basically, I go in, I see how they're doing. Staff does the vitals. I apply it, put in a timer for 15 minutes, put it on the door. And then my staff checks them at 15 minutes, the vitals, checks them at another 15 minutes, and then puts this like gel stuff on there to chelate or to pull away all the capsation, and then they're on their way. So I only see them for that, must be maybe 2 minutes. So it's real quick. It does take up a room in your office because you have to sit there for 30 minutes. But besides that, it was fine, and he's getting benefit from it. Next was an 84-year-old man with a left hallux IND, and the last patient was a 56-year-old female. So she has, this is kind of a challenging one, she has bilateral forefoot pain, and she works on her feet all day, she works in a factory. She didn't really get better with what we gave her with the shoe changes. I gave her a Medrol dose pack. Another doctor gave her a gabapentin because it's possibly nerve pain. It could just be that she's working. Now, I'm not sure if she's just not wanting to work or what, but she when patients come in and ask about like FMLA, or Family Medical Leave Act, I think, man, how do you live on that first? But I guess if you don't want to work. So I'm not too much of a stickler for that. So I'm going to see her back in 2 months, and she doesn't want to work for 2 months. And I'm thinking, what would I do for 2 months? I go crazy. But that was what she wanted. So And then I said, if it's not getting better after a couple months, then we'll get an MRI. But I don't think there's really anything big going on with this patient. Okay. Once again, I hope you guys found this beneficial. I am putting together a challenge, a Podiatry Practice Mastery challenge. We're going to do a 6-month challenge. So if you'd like to be part of it, shoot me an email Don at Podiatry Practice Mastery. The whole goal would be to optimize to get your practice past your personal production past the $1 million mark. That's what I'm doing with all these podcasts. But I find a lot of times it's better to have a little bit of accountability. I was talking to a doctor recently. He was struggling with some simple things, but it's not obvious when we're in the midst of it and we're really, really busy. So if you want to be a part of another group, it'll be only podiatrists there. We're going to have a small group. I limited the number. You should be seeing some emails if you're getting my emails. If you don't get my emails, shoot me an email and I'll add you to the email list if you want that. If you have any questions, let me know. I think it would help you. Because I think that accountability can be beneficial. Okay, talk to you tomorrow.